Hello everyone. So today in this topic I'm going to explain you about the gout, the pharmacology. This is a topic about pharmacology. So we are going to discuss about the drugs. So in gout, as we all know, gout is a condition in which hyperuricemia is there. Means there is increased level of uric acid which is get deposited in our joints and it get lead to precipitate and there it lead to inflammation. So this is the whole definition of the gout. So in simple words we can say that gout is a condition in which hyperuricemia is there. Means uric acid is increased. So hyperuricemia. So here we have two types of gout, that is acute form and the chronic form. Acute which occurs earlier and chronic form which occurs later. So these were the two types, acute gout and chronic gout. So in acute gout there is raised uric acid. So uric acid will increase in blood. It goes into the joints, and there it precipitate and lead to inflammation. Precipitated and leads to inflammation. While for the chronic form, in this also uric acid is in high quantity. So uric acid is high, but it will not go to joints and there is no symptoms in the chronic gout. So it not go to joints and no symptoms will be there in chronic gouts. And for the treatment of chronic gout, we have to decrease the uric acid. This is the simple treatment that we will use. So in this we will use the treatment is to decrease uric acid. While for the acute gout, we have when the uric acid is accumulated and it is precipitated, there it lead to the inflammation. So pain and inflammation of joints, and most importantly the pain and inflammation is in the metatarsophalangeal joints, that is the MTP. So for this the treatment what we will give for the acute treatment. So for the acute treatment we have the NSAIDs drug, non-steroidal anti-inflammatory drugs. That is the drug of choice for the acute form. Please remember, drug of choice in the acute form is NSAIDs, and the second one is the steroids. And we also can give the colchicine drug where the colchicine is most effective, but it has lots of side effect also. So the colchicine has side effect also, and in the side effect it can lead to myopathy or it can also lead to the severe diarrhea. Severe diarrhea will be there. So these were the side effects of the colchicine. So for the colchicine we have side effects, that is it is the leads to myopathy and severe diarrhea. So for the acute gout we have the drug of choice, that is NSAIDs, non-steroidal anti-inflammatory drugs for the drug of choice for acute gout. Now for the chronic gout, we have, like here what will happen in the chronic form. So for the proteins or the purines compound, they get metabolized and they form the xanthine, and after xanthine the xanthine will get oxidized by the xanthine oxidase enzyme. It is get oxidized by xanthine oxidase enzyme which is insoluble. So xanthine is oxidized by xanthine oxidase and it form to uric acid. And uric acid is excreted by the kidney. This is the normal process for the uric acid, that how it will excreted from our body. So it is excreted by our kidneys. But sometimes it is when in the chronic gout, what will happen, what we can increase the xanthine oxidase. We can inhibit this process so that uric acid will not form. So first we can inhibit this step, that is xanthine oxidase step. We can inhibit this enzyme xanthine oxidase so that uric acid will not form and it will not get precipitated in our body. Or we can also do the second step. The second step is we can increase the excretion by our kidneys. So if excretion will increase, then when excretion will increase, it can get excreted from our kidney so that it will not precipitate in our kidneys. So this step also we can do. Now for the inhibition of xanthine oxidase, so now here we have the first step, that is the decrease formation of uric acid. This is the first step. We have to decrease the formation of uric acid, and how we can do it? We can do this by inhibit xanthine oxidase. By inhibit xanthine oxidase enzyme. So these two steps we can do. First one is the inhibition of xanthine oxidase. And which drug can inhibit the xanthine oxidase? So for this we have the drug that is allopurinol. And which is the drug of choice. Please remember that it is the drug of choice Allopurinol is the drug of choice because it inhibits the xanthine oxidase and it decreases the formation of uric acid. So if uric acid is not there, then there is no gout in our body. So xanthine oxidase. So it is the drug of choice in the chronic gout. Please remember, for the acute gout we have the NSAIDs and for the chronic gout we have the allopurinol. So for the chronic gout the drug of choice is allopurinol. So if someone is taking allopurinol but it will not effective, means that person is allergic to allopurinol. So what we will give? Then if some person is allergic to this drug, allergic to allopurinol, so we can give febuxostat. Please remember, febuxostat. We can give this drug, and how we can remember it? We can remember by XO, and stat means inhibition. So stat means inhibition, and here X means xanthine and O stands for oxidase. So xanthine oxidase inhibitor drug. Xanthine oxidase inhibitor drug, that is febuxostat. If someone is allergic to allopurinol, the second choice what we can give is the febuxostat. So this is the first step inhibition, that is inhibition of xanthine oxidase. Now the second step means we have to increase the excretion process so that uric acid will excreted from our kidney. So for that we have the drug. For that we have to increase the excretion. For the excretion process we have the uricose uric agent. For that we have uricose uric agent. And for in the uricose uric agent, if we will give these drugs, so after taking these drugs, the patient, we have to advise the person should take plenty of water so that uric acid should not get precipitated, because if uric acid get precipitated, then there will be inflammation and the acute gout form will be there. So we have to inhibit that precipitation. So for that we have to suggest the patient to drink plenty of water. So with this we have to give suggestion to drink plenty of water. And what were these drugs? So for the increased excretion we have the drug that is probenecid. We have the other drug that is sulfenpyrazone. We have benchbromarone, and we have the lesinurad. Drug. So these were the drugs which increase the excretion from our kidney of the uric acid: probenecid, sulfenpyrazone, benzoboranoor, and lesinurad. And one important point is there, like here the excretion, here uric acid is excreted by kidneys, but in the drugs in the birds there is one different process, that is uric acid, and it is metabolized. In birds uric acid is metabolized to allantoin. Which is a water soluble component, and it will not get precipitated, and it never get precipitated in birds. So by taking this in account, we also made one drug so that uric acid is metabolized. And how we can increase the metabolization of uric acid? Increase metabolization of drugs of uric acid. We give one drug, that is not only the one drug, means we have uricase. In that we have uricase enzyme in that, and the drugs were which have the ending uricase, that is rasp uricase, or we can say pagloticase. Just we have to remember, case is the ending there, which in which uric acid is metabolized to allantoin, and allantoin is a water soluble and it never get precipitated, so no gout will be occur. So rasp uricase or pagloticase. And how we can remember it? R stands for the recombination and B stands for the bird. So we made this from birds. And pagloticase is the longest drug. Please remember, it is a longer acting drug. Longer acting drug is the pagloticase and rasp uricase. So these two drugs which increase the metabolism of uric acid. So that's all for the gout, that is acute gout and chronic gout. I hope this video is benefit for you. Thank you. Bye bye guys.